Hey, y'all, it's time to wake up. Before we get started with my guest today, I want to talk about the murder of George Floyd. All the police that were on the scene, and especially the cop that actually did, the police officer that actually did have the knee on him, they've all been fired, waiting on charges to be filed. There's the expected civil unrest in Minneapolis, Minnesota, over this event. And I'm here to say, while civil unrest is good, some people are calling for reactionary tactics to strike back. Let me tell you, we're outgunned, so that doesn't make any sense to strike back. But we have to use our power, since African Americans and people of color actually dominate in the urban centers and dominate in terms of the voter populace in urban centers. We have to use our power of the vote to make sure we have strong leadership that will not accept this type of behavior from the paramilitary forces, which are known as the police. That's all we can do right now. We can protest, yes, we can protest, but we can't strike back. We start striking back, then we have some mass genocide going on. It's funny to look at this, and you think that with Eric Garner, when he was killed, after all that outrage, that we would have learned by this point. We would have learned by this point that, or at least the police would have learned by this point, that it's unacceptable. This behavior is unacceptable. It's been said that police brutality is not on the rise. It's just they're videotaping them is on the rise. So they know they're being videotaped. All right?
Okay. All right.
Here we go. Hey, you all, I want to introduce you to Linda Little, the CEO of the Neighborhood Servicve Organization. Linda, how are you doing today?
Hi, Steve. We're safe and well here at NSO, and glad to be with you.
You serve the homeless population of Detroit, the veteran population of Detroit. How are they doing during this COVID-19 crisis?
Steve, I think, this population is struggling with this just as much as everybody else is. The challenge is they don't have access to the kinds of information that you have, so we try to provide them with updates, give them all the tools and information that they need, but really helping to support their basic needs right now. Some of the population who had, jobs that they were able to work, whether it was under the table employment, as you know, it's a real thing. People get paid under the table, or cash-based business, or they're working in restaurants. They couldn't do that. So they had no income. We were meeting basic needs during this time, and we still are, helping people to get access to stimulus checks and other public benefits that they are entitled to, and really just trying to keep people safe and healthy during this time.
The homeless get stimulus checks?
Yeah, there are a lot of working homeless, Steve. And so those that are working and paid taxes, they qualified for the stimulus check.
No, that's something I never would have known about. You've established a very innovative partnership for recuperative treatment, recuperative housing for the homeless. Tell us about that.
Yes. So, one of the things that I've been working on in NSO's portfolio over the past year is to add medical respite for the homeless. So for those who are, don't really need to be in the hospital, but they're not quite ready for shelter or the streets, a place for them to recover and get well. And so what's happened during this COVID-19 pandemic, when hospitals were anticipating this surge, they came to us and other community partners and said, hey, let's talk about how we can collaborate together. And so we wanted to provide a solution that would help, offload some of their bed capacity for those folks who are ready to be discharged into the community. And this was a real unique and distinct population. It's not just those that it's really those who are homeless, or the transient population who now can't go back to their cousin's sofa or sleep in their friend's basement. Or it's a senior or someone else who may be high risk, who has someone who's COVID positive in their homes. Or it could be a pregnant mom who has exposure to someone at home or is living in a transient population. So This is like an unmet need in our city. And I'm glad to be working with Ascension Health System, Henry Ford Health Systems, Chas Center, Authority Health, COTS, and Detroit Area Agency on Aging. And NSO is the lead partner in this, but we're very thankful to United Way for believing in this program and helping to support the community in this way.
Now, where is this program housed?
So it's at a hotel. We've partnered with a hotel in Detroit to help provide 50 rooms for us to access for this. We're not disclosing the location because we don't want people to show up there. It's by referral through the hospitals only, or any other partner that we might have. We've been talking to possibly health departments that may need help with those that they, for instance, when they're doing contact tracing, they may identify someone in the home who may have been exposed or can't be at home because they've been exposed. And so that's somebody who's non-COVID who needs to get out of the house to prevent exposure, and maybe they need a safe place to go. So we're just being creative to see, and nimble to see how we can meet this need that's in the community.
So is the maximum number of beds 50 that you're going to have?
So this hasn't been done before, right? So we had to pick a number. So based on the conversations and the needs assessment that we had at the time, we said 50 beds should be enough for us to start with this pilot project. If we need to increase more, there's definitely the capacity to do that. But we wanted to start with what we thought was a reasonable number to launch the program and start meeting the need. So it's going well. It started, this is our second week into having patients on site, and we're excited, and they seem to really enjoy the opportunity, and we're able to transition them into more long-term housing solutions.
Okay. How are the other programs
about it is that we're also providing the wraparound services. Yes. Mm-hmm.
Okay, and that's what I wanted to ask about. How are the other services of NSO integrated into this? So go ahead, tell me that.
So once they come to us from the hospital, we are able to then engage in all the psychosocial wraparound services. That's where our partners come in. NSO is doing all the case management and care coordination. We're linking with the hospital for specialty care, for instance. We're linking them to primary care to make sure they get their post-hospital follow-up care. We're making sure they get all their medications that they need. We're providing them with meals, a safe place. They have the amenities of the hotel. We are really working to give them the comprehensive services that they might need, and that are available in the community, not just within NSO, but within the community at large, to access their particular situation and create solutions for them.
Okay. Now, to the rest of your population that you serve, how are they dealing with this during this crisis? How are you dealing with that there?
Well, Steve, so as you know, most of our work is in the community. 80% of the services that we provide is in people's homes, in group homes, in nursing homes, AFC centers. So we are a very mobile organization. So when COVID-19 approached us, our team established a command center, and we moved very quickly to convert us to telehealth services. I think we did it in a matter of like 3 or 4 days, even before it was, I knew that it was going to be, I was on a hope and a prayer. I had faith that we would be able to bill for those services, but I knew we needed to shift to a better way to continue to provide access to services and meet the needs of the community. So we're mostly on telestaff. The majority of our entire team is teleworking. There's a subset that has to come in and deliver face-to-face services like our shelter. We actually relocated to Mani because our existing location did not allow for us to appropriately distance.
For people that don't understand, what is Tumani?
Tumani is our emergency shelter. It's the only 24/7 drop-in center in the city of Detroit. And Tumani means faith and hope. in Swahili.
The Tamani Center is located in the Cass Corridor, correct?
That's correct. It's on MLK and Third.
So where is it relocated?
And there were, it's relocated to an undisclosed location that we've been working on with the city of Detroit. So the city provided us a building for us to house the population that we've been serving since the middle of March in that new location. And it's large enough so that people can space appropriately and meet all the CDC guidelines to protect the health and well-being of those that we serve and the staff. And now we have cots. As you know, Tamani before had chairs so that we can get in as many people as we could. And so now there's cots for folks to have access to, which is really good. And they really appreciate the support of the new site, the temporary location. We have increased our medical staff from 2 days a week to 5 days a week. So we're providing medical clinic and primary care services on site 5 days a week. We're also providing telebehavioral health services. So our psychiatrist is doing, kind of what we're doing with clients to make sure their mental health needs are also met. We're making sure they have their medications. We're really providing full support for the clients that we're serving at the Tamani Center, even at the new location right now.
The undisclosed location.
The undisclosed.
So the people that used to drop into Tamani, how did you let them know where the new location was?
Well, so the interesting thing is we have what's in Detroit called the continuum of care. So there's a central access point for homeless services. And so folks have the CAM, the coordinated assessment model, that they contact when they need homeless services. And so we're still working with the CAM to get those referrals, and we get referrals every day. So we're still providing that access to folks who need us.
Okay. Is there anything else you want to add, Linda Little, to the great services that NSO is providing Detroit?
I think, Steve, as you know, the African American community has been hit hardest by this pandemic for various reasons. I'm honored to serve on the Governor's Disparities Task Force and working to help create solutions around that issue. But one of the things that we've done is really partnered with DABO, Reverend Horace Sheffield and his group, and they are doing COVID testing in the community. They took charge and he stood up a whole enterprise to do testing in hotspots in Detroit. And so we are working with them to provide basic needs support to those who come to the testing site. It's very important that we provide this support to our community right now. So we have case managers who are doing outreach every day after every testing site location and making sure that their food needs are met. If they have utility needs, we're connecting them to utility assistance. If they need support with paying their rent, if they need anything, even if they're not feeling well and they need linkage to healthcare, we're helping with that. So we're really trying to wrap our arms around this community and help, provide support wherever we can during this crisis. So it's not just our current population that we're serving, but it's the community at large as well. We're distributing food, we're helping to deliver meals to seniors, we're doing grocery shopping for seniors. We're partnering with food banks to deliver meals to those folks that are in our scattered site and permanent supportive housing units. So we're really deploying our staff and really reimagining how we do our work in this Metro Detroit community to make sure that we're meeting the needs as they occur. And we continue to assess that every day in our command center. We talk about, how are we doing with meeting the needs of our clients and the community, and we continue to adapt to that.
Okay.
I do want to say that the economic impact of this pandemic is yet to be seen. And NSO stands ready. We're readying ourselves to meet increased demand that we anticipate is going to occur as a result of this crisis. Even thinking about as the moratorium on evictions is lifted. And what's going to happen to those people who haven't been able to pay their rents, but they're currently housed? So we're trying to anticipate what those needs are and structure our programming to meet those needs of those that we haven't even had the opportunity to meet yet.
Okay. Linda Little, I want to thank you for joining us today. How can people support the Neighborhood Service Organization?
You know what, Steve? Thank you for that question. Much of what we've been able to do has been through support of viewers like yours. And so if you go to our website, www.nso-mi.org, that's nso-mi.org, you will see a link to donate for our COVID-19 relief efforts. We would greatly appreciate the support.
All right. Linda Little, thank you very much. And ladies and gentlemen, I want to thank you very much for paying attention. If you want to support our operation here, just hit us up on Cash App, $ Steve Hood Show. We need your help. That's $ Steve Hood Show on Cash App. Just $5 will keep us going. Thank you very much, and continue being awake.